This is the Emergency Medical Minute, brought to you by HCA Health One.
Okay, so I was going to talk a little bit about, do a little like pharmacology 101. So I wanted to talk about CYP enzymes and metabolism of drugs, because around like 70 to 80% of the drugs and medications that we give and take are metabolized by CYP enzymes. So it's kind of important to know the interactions between the enzymes and kind of between the medications. Are you guys familiar with like what a CYP enzyme is? Generally, yeah, some of you maybe.
Grapefruit's not good for it.
Yeah, grapefruit's not good for it, right? Grapefruit is a known inhibitor of CYP enzymes. And then there's also a bunch of inducers and inhibitors, right? So do you guys know what medications are notorious for inducing a lot of the CYP enzymes?
Yes. MAOIs?
Not MAOIs, because those are like specifically monoamine oxidase inhibitors. Yeah.
Is warfarin an inducer?
Warfarin's metabolized by CYPs. Yeah. Rifampin is definitely an inducer. Yeah. Yeah. What else? There's one drug that we give a lot in the ED. Not Zofran. Yeah. So Phenobarbital is actually a pretty powerful inducer of CYP enzymes. Do you guys know what happens then to medications that are metabolized by CYPs when you give an inducer? Yeah, so you ramp up the metabolism, right? So you're going to reduce the concentration of the medication. One of the examples that we are given in medical school is like the medical student that's on rotations, that's exposed to TB, ends up taking rifampin, is on birth control, and then gets pregnant, right? So she had her birth control induced or reduced by the rifampin induction of the CYP enzyme and then made less effective, right? And then some of the inhibitors, you guys know some CYP inhibitors. So there's a few infamous ones. Most of the antifungals like ketoconazole are pretty powerful inhibitors of CYP. And then like Brian mentioned, a grapefruit juice is a known inhibitor of CYPs as well. And then I was talking with Adam earlier and he mentioned Bactrim. So trimethoprim-sulfamethoxazole is a pretty powerful inhibitor. And it turns out that one they did a study on in 2008 that actually showed elevated INR levels in patients taking warfarin and concomitant Bactrim, which is definitely something to be aware of, because when you have an inhibitor of the enzyme and someone is on warfarin as well, that can definitely elevate the levels and then they're at risk for bleeding. Conversely, if someone's on warfarin, if they have an inducer of the enzyme, then they're at risk for clotting because it makes the medication less effective. So these are definitely things to be aware of and ask about. Another big one to know about right now is Paxlovid, which has Ritonavir, which is also an inhibitor of the CYP enzymes. So that's a good one to kind of watch out for drug-drug interactions, especially on people on warfarin or other important medications that are metabolized by CYPs. So, any questions? Nope. Sweet.
This has been the Emergency Medical Minute. Thank you for listening, and thank you to HCA Health One for their financial contributions. Support from them and from listeners like you helps us achieve our goal of spreading free education to the masses. If you'd like to help, please donate. Follow the link in our show notes. Thanks for listening.